being excited about vigilantism is not the path to civilization, it is the path to barbarism. Hey there, friends, fans, and foes of Dad Saves America. John Popola here, and I can't help but weigh in and explore the issues surrounding the execution of UnitedHealthcare CEO Brian Thompson at the hands of a clearly mentally deranged individual, and the even more deranged responses to that execution. Now, there's been a lot of ink and a lot of YouTube words already spilled on the matter, so there's a couple things I'd like to do in this video. Number one, I don't want to spend too much time on all the lunacy, because, as I said, there's already plenty of that out there in the world, and I would like to think I can help you understand things and share some broader perspective than just hot takes and nonsense. Number two, though, I do think that we do have to grapple with how are we going to resolve disagreements in our country. Being excited about vigilantism is not the path to civilization, it is the path to barbarism. When we are sick, it messes with our heads. Even if you just get the flu, something that you're taking for granted, your body, goes from being in the background of your mind to being all you can think about. Your outlook on the world changes drastically when you're sick or in pain. This is very physical and visceral and profound. And of course, if you encounter the healthcare system, insurance companies, hospitals, doctors, providers, and you're disappointed, it can be devastating because sometimes the outcomes are devastating. Loved ones die on the operating table or from complications or sometimes from negligence and neglect. People we love or ourselves get denied care that we feel is going to help us and sometimes that will actually help us. And that feels absolutely unjust, especially if we've been paying our insurance premiums all along and thought that this was the whole point. I want to acknowledge all of that at the outset because where I want to take us together is going to call into question a lot of things you might think you know about the system. That's what I'm here to do. But I just want to say, I get it. I've experienced it myself, and I understand why this is so hard. What I don't understand, though, as a human, as a Christian, is being gleeful about the murder of another human being in cold blood.
Why would you be in such a celebratory mood about the execution of another human being? Aren't you supposed to be on the caring, sharing left where, you believe in the sanctity of life?
I do believe in the sanctity of life. And I think that's why I felt, along with so many other Americans, joy, unfortunately.
I have to stop it. Joy. You can see the smile on Taylor Loren's face as she's saying this, as she's sitting there waiting to respond. It's perverse. It's sick.
Because it
joy?
Feels like...
Serious?
I mean...
Joy in a man's execution?
Maybe not joy, but certainly not empathy.
Certainly not empathy. Glee, joy, maybe not joy, certainly not empathy. I mean, that is psychopathic, is what that is. And again, I get it. If you just lost your wife or your kid, I get the sense of wanting revenge. I get it. But this reaction right here is the path to hell. This is the path to off with their heads revolution. And if you think your head's not going to be on the chopping block, you got another thing coming. Of course, Taylor Lorenz, though she is serially good at making a fool out of herself and being a hypocrite, was by no means alone. Here's a blue-haired socialist professor from the University of Pennsylvania, that wonderful institution, celebrating with heart on chest at the execution of a husband and a father in the streets of New York City. Despicable. Here's one person comparing the shooter to Anne Frank because he was apparently turned in by someone at McDonald's. Here's another professor, Marshall Steinbaum, deciding that maybe we should have mandatory euthanasia because it turns out it was an elderly woman who turned in the possible shooter at McDonald's. But I saved the best, or should I say the worst, for last. That, of course, is Senator Elizabeth Warren, who loves to rail against the rich and powerful while failing to remind us all that she was pulling down over $400,000 a year at Harvard for teaching one class and producing bunk research on personal bankruptcy.
And what happens when you turn this into the billionaires run it all is they get the opportunity to squeeze every last penny.
Yeah.
And look, we'll say it over and over. Violence is never the answer. This guy gets a trial who's allegedly killed the CEO of UnitedHealth. But you can only push people so far.
You can only push people so far, says Senator Elizabeth Warren. This is contemptible language. You can only push people so far. This is Liz Warren trying on the old Chris Rock joke from the 90s about O.J. Simpson and the fact that, well, I don't think he should have killed her, but I understand. This is despicable behavior on the part of someone who puts herself forward as a leader in our country. It's also the exploitation of really the act of a psychopath. We don't know what this guy's intentions really were. He left a minuscule manifesto with a bunch of nonsense in it, but he's clearly unwell. And reading into this, some grand teachable moment, I find to be utterly repulsive. And yet, here we are talking about healthcare and health insurance and the American healthcare system. Ironically, for like the first time since the passage of Obamacare, even in the aftermath of the COVID pandemic, there was no substantial conversation about the American healthcare system. It is, I guess you could say, a silver lining of this tragic act that there's some amount of debate resurfacing about how to improve healthcare in this country. I'm a little uncomfortable participating in it, to be perfectly honest. But I think if you're going to have a discussion about a subject, it might be good to get onto the same page about the facts. And it turns out most people, to be perfectly honest, don't know jack about what's going on in healthcare. This is problem number one. Health insurance is not health care. These are two separate, though related, things. Health care is doctors and nurses and hospitals and surgeons and specialists and pharmaceuticals and treatments and rehabilitations. It's the services of trying to make you better. Health insurance is a financial system to try to distribute the risks and mitigate the costs of unanticipated health events. That is what health insurance, in theory, is supposed to be. But even when you have it, and even when it's good, and even when it pays all the bills, it's not the healthcare. It is a payment mechanism. And it also turns out to be a rationing mechanism. And this gets to the point that I think we need to start with. There's no such thing as universal healthcare. There's no such thing as universal anything. In every country, healthcare services are rationed one way or another. Not everyone gets everything they want or need all the time immediately. In some instances, people have to wait, often very long times, sometimes too long, and they die waiting. In other instances, people are simply outright denied certain care or coverage and payment for certain care. This is true everywhere. It's true here in the United States. It's true in the UK and in Canada and in Italy and in Sweden and the Scandinavian countries and in Australia and Singapore, and you name the country, and I will point you to a place that is balancing how to ration the scarce resource known as healthcare services, because we live in a world of scarcity. This is adult fact number one that all the universal free socialist rhetoric can't get away from. We actually have serious shortages in many cases of doctors and nurses, for example. And as it turns out, the reasons for that are partly because of the way we try to subsidize the consumption of care. The other thing that I think just gets forgotten or hasn't been talked about since the Affordable Care Act days is the fact that American healthcare has a really peculiar structure that is fundamentally irrational and an accident of history. I've actually made videos about this in the past, and I've experienced this, again, as an employer firsthand with a lot of painful and punishing and time-consuming detail. And that is that employers provide most of the health insurance in this country to employees, and that health insurance coverage is given favorable tax status. So how did this happen? Back in World War II, there were wage price controls inflicted on the economy and on the public in the name of trying to ration resources for the war effort. This was not, strictly speaking, necessary. This kind of wage price control stuff never works. But it did pose a problem for employers who were facing, frankly, a tight labor market. You remember, Rosie the Riveter entered the labor force because we sent most of our working age men off to Europe to fight the war. Well, Europe and the Pacific. So what employers decided to do was offer non-wage compensation in the form of other benefits, one of which was health insurance. Now, after the war ended, labor unions lobbied Congress and the government to keep these compensation systems tax exempt. And so that became enshrined in our tax law, that when an employer provided health insurance, it was tax-free compensation. And this laid the groundwork for the first problem in our health insurance system, that it is not universally accessible, it's not portable, it's tied to your job. You lose your job, lose your health care. That's stupid. And people calling for some government-run Medicare for all scheme, frankly, this one aspect of it would be a step in the right direction, moving people off of employer and job-tied care to something that is universal and portable. Except, of course, we already have this in the private market. It's called all the other insurances we buy. I've had life insurance policies that have moved with me for the past 30 years as I've moved from state to state to state. One thing that the shooter did say in his short and ultimately low information content manifesto was that we have the most expensive healthcare system in the world, and yet we rank number 42 in life expectancy. These are essentially the number 1 and number 2 talking points for why American healthcare needs to be completely overturned and handed over to the government. The only problem with these two is they're misleading, if not outright false. So yes, Americans do spend more than other countries. However, there's a couple interesting facts to acknowledge here. The first is, as a matter of the average, Americans are actually richer than all of Europe. We are actually a relatively wealthy society. Now, you might be living paycheck to paycheck, and I feel for you. That's difficult. I've been there myself. But as a country, if we're talking about national policy, the United States is one of the wealthiest. I think it's the wealthiest country on earth in the aggregate, and we're pretty close to the top on income per capita. As we get wealthier, we spend more money on healthcare, especially as we age. We'll put links to these articles in the comments below because I think they're worth taking a look at if you want to wonk out on it. Others have explored this in greater depth, but the gist is that Americans are richer than everybody else, and healthcare is a superior good, meaning it's something that you buy more of as you get wealthier. And we actually do spend more and buy more procedures. So our spending on healthcare is at least partly a reflection of our wealth and our preferences, our desire to spend our income on things that might hopefully improve our health. Whether they do or not is another matter. We buy more surgeries. We buy more services. And so we spend more. It turns out that when adjusted for costs and purchasing power, our procedures aren't dramatically more expensive than other countries. In fact, sometimes they're not more expensive at all. So it is that we are actually buying more healthcare than other countries. The other thing that I think is really important to disentangle is that the life expectancy numbers that we all hear about and that have been pulled to the foreground of the conversation in the public because this maniac noted it, and because it is the talking point for why American healthcare apparently sucks, need to be disentangled because people can die for a lot of reasons. And it turns out many of the reasons why Americans die at higher rates and sooner than other countries have nothing to do with doctors, nurses, medicines, or hospitals. This graph, which is kind of difficult to parse, shows the reasons why basically other countries have higher, or in some cases, lower mortality. What you'll see, or what I will talk you through, because this graph is hard to read, is that everything above the line 0, that's where we're doing worse. And the drivers of that are drug overdoses, firearm-related deaths, homicide, alcohol, motor vehicle accidents. These are not things that are the fault of the healthcare system. These are the fault of our lives, our behavior. becoming an alcoholic and dying of an alcohol-related disease is not a sign that our healthcare system needs to be completely overturned. It is a sign that you have a problem, or I have a problem. So circulatory and diabetes, these are lifestyle-related diseases. We are a fat country. We are fatter than France. Go to Paris, look around, you'll know what I'm talking about. I've spent a bunch of time in Italy. They're fit and lean in that country, and they're eating plenty of pasta. When you look at the countries and populations that are comparable to Americans in terms of these behavioral things like obesity, you find that the life expectancy and disease outcomes are very, very similar to ours. It is not our doctors and our health insurance companies' faults that we're fat. There is another part of the story, though, that I think is harder to talk about because, frankly, I think when you hear this, you're not going to like it and not going to want to believe it. Our health insurance companies aren't even really that big of a problem, actually. Not if you look at it in the aggregate. They are not very profitable companies. They basically are low-profit middlemen that provide this actuarial calculation of how do we try to pool all of our patients' and customers' money and try to redistribute it out to the people that need it for actual healthcare events and not go bankrupt and close up shop. Noah Smith, who is frankly a left of center economist, but a moderate and reasonable guy, pulled together an article that is worth reading where he notes a couple things that I'm just going to call out here because I think they are very, very instructive. If you look at United Health's profit margins, its net profit is around 6%. So as he writes, that's only about half of the average profit margin of companies in the S&P 500. And other big insurance companies are even less profitable than UnitedHealthcare. Elevance Health, the second biggest, has a margin of between 2 and 4%. Centen's margins are usually 1 to 2%. Cigna Group's margins are usually between 2 and 3%. These companies are just making very little profit at all. If UnitedHealthcare Group decided to donate every single dollar of its profit to buying Americans more healthcare, it would only be able to pay for about 9.3% more healthcare than it's already paying for. Now, 9.3% more healthcare isn't nothing, but profit margins go up and down. Here's another point, and this point is shocking. I was shocked when I saw this myself. This is from Our World in Data, and the sources are actually from multiple sources, including the World Bank. Take it or leave it, it's the best we've got. Americans are paying a smaller percentage of their healthcare costs out of pocket than people in most other rich nations. Look at this graph. We are near the bottom. The only country paying less out of pocket as a share of income than Americans is France. Let that sink in. That doesn't sound like any part of the discourse that's out there surrounding this murderous vigilante tragedy and the sudden rediscovery of healthcare as an issue on our public discourse. The fact of the matter is, most of what we're told about what's going on in our healthcare system is just a lie. It's just nonsense. But you might be thinking, this sounds like apologetics for big corporations that are paying our CEOs $10 million a year. And isn't the profit motive fundamentally corrupting? Isn't it still immoral to have a system in which I profit and make more money by denying someone life-saving treatment? Isn't that grotesque and barbaric? Isn't it every bit as barbaric as gunning down a man in the street? Isn't this the moral equivalency that we're talking about? Well, you have to confront a really uncomfortable and surprisingly little known fact about the actual providers of most healthcare services in America. And that is, most of our hospitals in this country are non-profit organizations. Most. And in fact, many of them pay their CEOs even more than UnitedHealthcare was paying Brian Thompson. Now, you can bemoan that, that's fine. But the notion that the problem with American healthcare is it's a bunch of greedy for-profit investors and shareholders and managers sucking up all the resources and leaving none for us as the public and as patients is simply false. That is cold comfort if your mother or father or brother or sister or spouse has been denied care or coverage, or has died or been very seriously injured by our healthcare system. I realize that, and again, I come from a family of doctors. My own grandfather, Gino Popola, was a doctor, and he used to tell me, do everything you can to stay out of the hospital. Hospitals are where people get sick. I'm not doing apologetics here. I'm just trying to present you with the actual facts of the matter, because you can't fix a problem that you don't understand. And you really will do a lot of damage trying to fix a problem, the understanding of which is actually the opposite of what's going on below the surface. There's two other things I want to talk about real quick before we wrap up. The first example comes out of the Affordable Care Act, Obamacare. One of the things it did was drive up the cost of health insurance premiums big time. And the reason it did that is that it didn't simply expand coverage, whatever that ultimately means. What it really did below the surface was require everyone's health insurance to cover more things. The money has to come from somewhere. So among the things that were added to the list were pregnancy and pregnancy-related items. One of the things that got covered under Obamacare was breast pumps, and the outcomes are what economists like Thomas Sowell would expect, but what Americans don't tend to understand.
The owner, Amanda Cole, she spent most of the last couple months trying to get in network on a major insurance plan, and she's succeeded.
Now we are a national provider, giving out breast pumps to moms throughout the country. That's a huge change.
So a huge change for the breast pump vendors. And this new tiny line in the legislation is a huge change also for the breast pumpers.
The new moms, the people who want breast pumps.
Right. I met this one woman, Caroline Shawnee, Yummy Mummy customer, and she was taking a break from shopping to nurse her baby on the couch in the back. And she already has a breast pump, which she paid for out of pocket. But now?
I don't know. I'm thinking it's good to have another one. Why not? So
Weird things happen when you take the price out. Why not start a whole collection or upgrade to the deluxe model?
The thing is, if you don't have to pay for it, this is what it's like. It's like, why not get the nicest one?
Oh, if you're paying, I'll have two. This is the buffet economics of putting everything into a central pot, a public trough. That's not the only problem, though. When you put all the money into a public trough, it becomes way more complex and impossible in some cases to reasonably figure out how to spend it. And a different story at NPR actually talked about this, because when Medicare was first introduced, they found this problem on their hands. How do we pay doctors?
Turns out doctors had been giving out a lot of free care to old people, and now they were going to get paid for that.
That's an important thing to note, by the way. Before Medicare and Medicaid, doctors were giving out a lot of free care, and they were operating much more like plain old services businesses, like your local oil change company. You'd walk in, you'd pay cash, you'd see the doctor, you'd spend more time with them than you do today, and you'd walk out, and that would be it. It was a cash business, and that was better. But with the introduction of Medicare, things started to change.
And within limits, whatever they asked for. Dr. Lucien Leap was a practicing surgeon at the time.
We found out what the general fee for a service was and charged that, or maybe added 10% because, of course, I'm better than average. And so it was an incentive for doctors to charge what they thought was reasonable for them, and then, of course, to increase it every year by, say, 5 or 10%.
Medicare's solution for how to pay doctors put into cement this idea of fee for service, paying doctors per procedure for every test, every scan. That sounds reasonable, but it served as a nudge to err on the safe side, to do more tests, to do that exploratory surgery.
Very quickly, Medicare realized that this was a horrible, bad incentive. It was producing a lot of unnecessary procedures, a lot of orders and scripts to get this test and that test and this test, which is not the way most markets work. We don't see this in normal markets for normal goods and services. And we also don't see it in the parts of the healthcare system that aren't corrupted by insurance and government payments. Plastic surgery and dentistry in particular. A favorite among free marketeers is to point out LASIK eye surgery, which is it used to be a complicated procedure. It's a scary procedure, but the prices for that procedure have gone down dramatically because it's elective, because you pay cash. So when you're paying your own money, you price shop. And when the government or the insurance company is trying to decide for you and for millions of others, you get into a whole world of bureaucratic equations that quickly get gamed, and whole industries of gaming the gaming takes place. That's why the system is so crazy. That's why you go to the hospital or go see your doctor and nobody knows what it costs. Not the doctor, not the woman at the front desk, not the person at the back office who gives you your bill. Then you go home having paid $25 as a copay maybe, and then 6 months later you get a bill that's not a bill. What do you mean? Why did you send me this if it's not a bill? And then you get a bill that's really high, and then you get another bill that's not as high. All of that seems crazy because it is crazy. There's a lot of complexity in this issue that is serious, you can't wave a magic wand and solve it. I'm not saying that you can. We can't get to utopia. But there are things we can do, right? When you look at our life expectancy, a large portion of why we lag other countries is our own choices. The way we eat, the way we move, the way we drive. And if we improve those, we will improve our health. I have never been great at working out, but as I've approached 50, I've been doing it on a regular basis. That I think is good. I want to live as long as I can. I want to have lots of grandkids and hopefully great grandkids. I have tried to raise my son to be active, to get him involved in sports, to kick him out of the house. We made school choices that were built around having plenty of outdoor time, not just sitting in a prison cell being lectured at, losing your mind. These are the choices we actually have at our disposal. And it turns out they can make the difference between us being a laggard in life expectancy and number one. So I hope this has helped you understand what's going on. I've only scratched the surface, as long and complex as this video actually was. But I also hope we can all agree that the path to progress for our society is not down the barrel of a gun. We aren't going to solve our problems by descending into a barbaric war of all against all. We live a relatively privileged life in this country. We live in a country with relatively low levels of violence. More violence than Western Europe, actually, but less violence than a lot of places in this world. And we take that peace for granted. And this has been a warning shot to us. And it's not the first, and I fear it's not the last, that we need to take a step back, take a deep breath, and try to return to something that feels like sane conversation. But I hope you have a great weekend. Let me know what you think of this in the comments below, and look forward to seeing you next week.